Hi, I'm Ron Yang and I'm doing a newborn assessment today. For the purposes of this video, I'm not gonna undress the baby, but let's pretend it is. And the room is at 89 degrees, which is perfect for an undressed baby. So for this assessment, first I'm gonna wash my hands and I'm gonna put on some gloves. Now, today we are assessing baby Phoebe, and she is a newborn about 8 hours after a vaginal birth. She, just general observations, she's a Caucasian baby. Her skin is pink, she is flexed with all her extremities. Her head is about a fourth or a quarter of the size of her entire body. And bilaterally, her movements are moving well. She does not have any bruising on her skin, milia, stork bites, or erythema. I am gonna, once I'm done with that, I'm gonna assess her breathing, her respiratory. And how I do that is I just simply put my hand right above her chest or abdomen, since babies breathe with their abdomen as well. A normal baby respiration is 30 to 60 per minute. For the purpose of this video, I'm only gonna do this shortly, but you should assess the respirations for a full minute because babies are known for having irregular heartbeats in respiratory breathing. It looks like baby Phoebe has a respiratory rate of 33. Now she doesn't have any, but there are 6 respiratory distresses that some babies can have. One is retraction, circummoral cyanosis. You got flaring of the nares, grunting, asymmetrical expansion of the chest, and rapid breathing, rapid respirations. Now, because baby Phoebe was a vaginal birth baby, she won't have this, and she doesn't have it. But C-section babies, cesarean babies, will, because they did not go through the birth canal to squeeze out some of this excess fluids, they are at higher risk for respiratory distress. Next, I'm going to check her cardiac or her heart rate, and how I do that is I should use a pediatric stethoscope, but I don't, so I'm going to use the bell of my stethoscope. So, and the reason why you want it smaller is so that you don't get any of those bowel sounds along the heart because they're so tiny, right? So you go right over the, you check for the apical pulse, and that's gonna give you the best sound. So, and you have to listen for a minute, but for the purpose of this video, I'm not gonna do that. Normal heart rate is going to be anywhere from 120 to 160. Regular baby heart rate. Also, I would go right over the apex and listen to it. And it looks like baby Phoebe's heart rate is 135, which is right at the normal range. Now, if I did see something or notice anything that's abnormal, we would do a blood pressure check on newborns, but in baby Phoebe's case, she's fine, she's normal, and you're gonna find that if you do a blood pressure check on newborns, they're gonna run anywhere from 65 to 95 on the systolic, and for the diastolic, 30 to 60. Now, after we're done with the heart rate or cardiac check, we're gonna check her head. And how we're gonna do that is we're actually gonna measure her head. I don't have a tape measure, but let's pretend that I do. Now I am gonna, I almost forgot. I need to check her brachial and femoral pulses, and I have to do both at the same time. So I'm gonna go ahead and listen to them, and you should listen to them for about a minute as well. So I'm gonna go ahead and do the brachial. Let's say it's a minute, it's a 135. Let's do the femoral, 135. They are both, the rims are both normal, 135 and 2+. So, okay, back to the head. So how we look at the head is that a baby's normal circumference, you measure it, should be anywhere between 32 and 36 centimeters. And how you do that is you kind of pick up the head and you go to the back of the head at the occiput and the mid occiput, and you would measure it to the frontal in the mid frontal. And for baby Phoebe, her measurement is 33, which is normal, between the 32 and 36. And I'm checking the suture lines. Let's pretend the head's not off. And there are no overlapping. Everything is well approximated. There's going to be 2 fontanelles. The normal one, you're going to have a diamond shape in the front, and the posterior is going to be triangular shaped. Now, you're going to see that Phoebe is normal, but if there's some babies that might have a flat or sunken in fontanelle, and that is indicative of dehydration. You're probably going to see some bulging as well, and that would be indicative of excess fluid or intracranial pressure. Now, there's some babies will have the caput cystidium, and that is edema on top of the baby's scalp, and it usually happens shortly after delivery or from the vacuum to help with the delivery. And it usually just goes away 2 to 4 days and it goes on its own. The other one and it does cross the suture lines because of that. Another one is the cephalohematoma, and that one does not cross the suture line because it is accumulation of blood underneath the periosteal and the skull. And that can take about 2 to 4 weeks to maybe a month or so, and it'll go away on its own as well. So after we're done with that, we're gonna take a look at our baby's eyes. Phoebe's eyes, as from observation, is a light brown. They are round. They're both equal. And I'm gonna take my pen light, and they do both accommodate with the light. So she does demonstrate pearl eye. I'm gonna take a look at her ears next. We're gonna look at the pinna, and it's gonna, which is at the top of the ears, and it's gonna align right to the outer campus of the eyes. So everything's normal for her. Now, I'm gonna look at the periauricles and see if there's any skin tags. If there is, she doesn't have any, but that is indicative of maybe malformation of kidneys and things like that. Now, the next thing I look at are the nostrils, and checking to see if there's any drainage. If there is, I will use the bulb and suck that out, whatnot. But I'm checking the nares. There's no secretions or no blockages, and I'm also checking to see if she's breathing well. I can check for patency by covering her little mouth, and then cover one of her nostrils, and I can feel for a little bit of air coming out, and I'll do the same to the other side. And so she's normal. There's nothing abnormal about her breathing. Her nares are fine. We're gonna take a look next at her mouth. So what I would do to check if the baby has suckling is what we call the rooting reflex. I just simply stick a finger in her mouth, and I will feel her baby Phoebe suckling. I'm gonna check for any symmetry. There's no drooping of the face, or if I check and I rub her chin or her cheek, she's gonna turn to act like she's gonna eat. So she's gonna want to eat. So I look in her mouth and around her mouth. There are no white spots in her mouth called Epstein pearls. I will also look around her mouth to see if there's any circummoral for baby Phoebe. She's fine. She's nice and pink, well lubricated, wet in her mouth, nothing blue. And if their baby has circummoral and it doesn't get better and it just increases with crying, that is a sign that there could be an airway obstruction, and we will need to call the physician for that. Next, I'm going to check for her neck and her thorax or her throat. There is no redding, no webbing or fat packs. We're going to check for movement. Looks like the baby the head is slightly tilted, which is normal, and it's actually helpful for her breathing and airway. Next, I'm going to look at her chest and her clavicle. I'm going to feel and inspect Um, for any secondary trauma during the birthing process, I'm gonna run my fingers right down her chest, and there are no bumps. Everything is cylindrical. Her chest shape, there's no intercostal retractions. She's breathing just fine. And I'm gonna take a look at her nipples. They are straight across from each other. They're symmetrical. They're a little swollen from maternal hormones from her mom, and there's no drainage as well. You're gonna take a measuring chest again from her back to the chest, right across the nipple line. And a normal baby's measurement of the chest is gonna be anywhere from 30 to 36. Baby Phoebe's is 34, so she's perfectly fine. Now I'm gonna look at her abdomen. Just like adults, we're gonna observe and watch first to see that it appears round, it's soft, it's symmetrical, there's no distensions, no abnormal movements. It does move with breathing, which babies typically breathe through their stomach as well. And I'm gonna then check, palpate, I'm gonna auscultate and listen to the bowel sounds, and I would do it for a minute in each quadrant as well. And for the purposes of this, I'm just gonna check it. She is a little hyperactive because she had some meals already with her mom from breastfeeding, and so, but if she was brand new, born within just a few minutes, you'll notice that they will be hypoactive. The color, I'm gonna move it off. I'm gonna take a look at her umbilical cord. It is red, bluish, white. I notice that there is one vein and 2 arteries. There's no bleeding or drainage. And then I'm gonna cover this up. No bulge present as well. Baby Phoebe is normal. Then we're gonna take a look at her extremities. She appears to be pink, warm, and of course she's flexed. Now we're gonna check for some reflexes. The moral reflex is where she would reach up for something. So what you do is you kind of slowly, you leave the head touching the pillow or her bed, and you kind of take her hand, and you can do this sometimes, she will grab your fingers, and that is a plantar reflex. Obviously not plantar, palmar reflex. So we check that, and while she's doing that, we're gonna lift her up, and a small little drop, and she's gonna grasp back into her chest. And so her moral reflex is fine. We're gonna check for any hip dysplasia. So what I'm gonna do is I take the legs and I bend up the knees and I rotate the hips out and back in, listening for any cracks, any sounds, any shifting. I don't hear anything, so that shows good reflex with her hips and legs. Again, we already did the palmar reflex, but what I would do is look at the palms of her hands and the bottom of her feet. There are no simian creases, but multiple lines and creases. So she's normal. Now, if I take a look at her ankles and feet, there's no clubbing, no webbing between the toes and fingers. They have all spread for me to see. I will take a look at her plantar flexion. How I do that is I simply place a finger right underneath her toes, and her toes will bend over and try to grab my finger. I do that to both toes, and they seem fine. Well, then what I do next is the Babinski reflex. I simply run a finger from the heel to the toes, and you'll see that the toes are gonna fan out. Looks like both of her feet does the same thing. They both fan out as I do the Babinski reflex. After I'm done with that, I need to take a look at the back since we assessed the whole front of baby Phoebe. So one of my instructors said it's best to just hold the baby up instead of flipping the baby over. So we're gonna slightly take the baby Phoebe up, and that's how I used to hold my baby too. So hold her in my arms like this. And what I'm gonna do is I'm gonna take a look at her back. Again, for the purpose of this video, she has her, she doesn't have any clothes on. So I'm gonna look at her back to look for anything that is abnormal. Looks like everything's straight in symmetry. I'm looking for a straight, flat back. There's no tufts of hair or any lumps or no dimpling. And I'll look even below the diaper. Everything's normal, no dimpling. Now, if there is any of the dimpling or the hair tufts, it's an indication that there is spina bifida or any cyst that may be there, and the sacrum has no dimpling as well. The gluteal folds are equal and and no symmetry. There's no Mongolian marks. Most, if not all, Caucasian babies do not have the dark green Mongolian marks. Now I'm gonna set baby Phoebe back down, and the last thing I need to do is check through assessment of her genitals. So I'm gonna take a look. Everything looks normal, pink, a little swelling from maternal hormones. But if I take a look at the anus, there's no bleeding or fissures, and baby Phoebe is done. Looks like she's reaching over to eat. So I'm gonna wrap her up, and I'm gonna take her back to her mom. I'm sure Phoebe Sr. would like to feed Phoebe Jr. now. So that's it.